Have you ever seen the slides?
Yes, sir. It is visible, sir.
Okay. Thank you very much. So actually, the most of the scenarios or most of the literature we see, generally we apply AI, artificial intelligence, on the data, and in that way, that actually data we are just like processing it. So it is in broad way, it is known as data science. So here actually in this talk, we will go a little bit further from this data science. It is a science of data. So like how this data actually has come from the system. So we will see use of signal processing in artificial intelligence framework. So when we say data, then actually this it is not associated with the system, but it is generated from the system. But when you say signal processing, actually the signal is generated by the system. So there is a role of signal processing, and the signal processing enabled AI models for medical diagnosis will be explained in this talk. And this actually recently, this there's everybody is applying AI, but now people want to understand what is happening during this AI based processing. So what is actually so analysis and interpretation part of AI that actually can be done with the use of signal processing. So when we use signal processing, for example, like you are doing analysis of brain signals, electroencephalogram, EEG signals. So we are assuming that actually this analysis, EEG signal processing or analysis of EEG and classification, that is done for the actually understanding the human brain. And similarly, when you are doing processing of electrocardiogram, ECG signals, indirectly we want to understand the heart from which this signal or data is generated. So data classification actually can be done with the AI, but when you want to do analysis interpretation, then actually signal processing plays an important role. So in this talk we will see what is the use of signal processing together with machine learning. And in real life there are many scenarios where actually we get multi-channel data. So like the data is recorded from the multi-sensors, it may be multi-images, multi-cameras. So in that way, actually, we will see mathematical framework, how to define multi-channel signals. And then recently our group has developed multi-channel signal processing techniques. So in this talk, actually, we will see such two techniques that iterative filtering and empirical wavelet transform, and that actually that we have extended for multi-channel data. So that actually will be presented in this talk, multivariate empirical wavelet transform and multivariate iterative filtering. And they are motivated by the empirical mode decomposition method that actually that has come from computer science. So most of the signal processing methods we use in electrical engineering, that is actually based on the mathematical equations like analysis equations, synthesis equations. But 1998, this algorithm that we call empirical mode decomposition, it has come from computer science researchers. So they actually, instead of using mathematical expressions, there is an algorithm which we apply on the data, and data automatically will be actually represented in terms of simple components. And simple components are easy to understand, easy to represent, easy to interpret. That all actually we will see in this talk. And there is a lot of applications for such kind of work. Like such work actually can be represented in the form of software, and the software can be integrated with the mobiles, smartphone, and computers. So in the rural areas, actually, such diseases can be done can be detected in initial stage. So timely treatment can be carried out. And urban areas also, we have actually less number of doctors and more number of patients. So this kind of actually systems, like in the form of expert system, intelligent systems, can be actually used for computer-aided medical diagnosis. So doctors, neurologists can perform efficient diagnosis of diseases. So there is so many applications. So with this background, let us start this talk. So this is the overview of this talk. First, we will see introduction, then the motivation for this multi-channel data processing. And in this entire actually talk, this is just for an example. We are taking this EEG signals for the study purpose, but it can be also studied for imaging, MRI imaging. When you are taking multi-channel like multiple images, all the images you can actually process together. So first we'll see introduction, then we'll go for motivation for this multi-channel data processing. Then this empirical mode decomposition briefly will be explained, and then we'll see empirical wavelet transform, and then multivariate empirical wavelet transform that our group has proposed. And we will see its application for detection of epilepsy from reference program EEG signals. And there actually this signal processing and machine learning will combine together. And then iterative filtering, and our group has developed multivariate filtering that will be explained. And after that, we will see its application for schizophrenia detection from EEG. In the end, conclusion will be provided. So this is actually based on the EEG. And when we go for clinical applications, we also use MRI, and EEG MRI both are required together for the proper diagnosis of any neurological disease. So these actually imaging also can be studied together with these frameworks. Actually, in real life, we record many signals or images from the human body, and they are actually unknown to us. They have a lot of information. How to obtain or how to get such information from these signals and images. So one of the important actually direction or the concept that was proposed by the Fourier in 1807, and according to Joseph Fourier, this complicated signal can be represented in terms of simple functions. They are simple functions, they are easy to understand, and you represent this complicated data or complicated signals images in terms of simple signals and simple images, and nicely actually you can understand them in terms of simple functions. And Fourier actually, Joseph Fourier, it is very interesting story about the Fourier. Fourier was actually from France, and he was very poor. His father was tailor, not mathematician, tailor by profession. So when Fourier was 8 years old, and sometimes some books say 4 years old, and then actually his parents died, and this Fourier used to work in hostel. And old time there was no electricity like today we have, and students used to use candles for study purpose, and remaining part of the candle they used to throw outside. And this Fourier actually used to collect these small pieces of the candles and used to make a big candle. And when night everybody was sleeping, Fourier used to study. And this Fourier actually he joined the French army, and from the French army he got an opportunity to go to called Polytechnic, where he was working on the prism, and we observed that this white light can be decomposed into simple 7 colors. Then he got idea, and he represented this complicated signal in terms of simple functions. And that actually concept will be used today in biomedical signals and images to understand them, interpret them in terms of non-functions. This Fourier also actually he became scientific advisor of Napoleon. So people asked him earlier, you are son of Taylor, and now you are scientific advisor of Napoleon. How do you feel? Then Fourier answered, I am the same Fourier. This is just a matter of time. So actually, he understood time in such a manner that he represented this complicated signal in terms of simple functions, which are periodic with respect to time. So when you represent signals like this is one stationary signal, just for an example, this is non-stationary signal. So stationary signal means mathematical models which we use to represent the signal, their parameters are constant with respect to time. And non-stationary signal means mathematical model that we use, any of these parameters of these models change with time. So then it becomes non-stationary. In case of Fourier transform, when you apply Fourier transform for this stationary signal and non-stationary signal, then it gives you a same spectrum. So this is one of the major limitation of the Fourier transform, because whatever you are interpreting this data in terms of functional frequencies, they are similar for stationary as well as non-stationary signals. So there is a lot of actually research is done in the literature to have this unique kind of representation in the frequency domain. So that gives you a new direction where actually everybody wants to have these basis functions in more general forms like amplitude and frequency modulated sinusoid. So like sinusoidal functions, amplitude and frequency, they are constant, but if you allow them vary with time, then it becomes amplitude and frequency modulated sinusoid. So this is actually suitable for narrow band signal, this model. And there have been two directions, fixed basis, adaptive basis. Fixed basis like Fourier transform, wavelet transform, etc. Adaptive basis, this direction has come from computer science. So like here, instead of using this mathematical formulation, we use an algorithm that is 1998, this direction is started. So it started from empirical mode decomposition, then empirical mode transform, etc. So now based on this narrowband model, any data which is wideband that can be represented in terms of superposition of narrowband signals. So this is the more general form of narrowband, and now this we can represent in terms of multi-channel data. So this is actually this is multi-channel data where each channel is narrowband, and this is more general form of the multi-channel data, that is multivariate multi-component signal. So each channel is now wideband and non-stacy signal. So that is actually each channel is multi-component and wideband. So this is multi-channel. So this is actually model that is very useful for us in this talk. So now in the real life, there are many scenarios where we have multi-channel data. So some of the examples are actually depicted here. First example is comes from vibration study, like gear fault diagnosis. We study multi-channel vibration signals, and we use all of them to find out that this vibration, detect the diagnosis, detect the like gear fault in the gears. And second example is this EEG signal recording electroencephalogram. So we are using electrode cap to a subject brain, and number of electrodes, they determine the actual number of channels in the multi-channel data. Third one is ECG recording, electrocardiogram signal recording, number of leads we are putting on the chest, and they actually they determine the number of channels in the ECG signal multi-channel. So these are the few examples where multi-channel data is actually available. Now, why it is happening now? Because these are a lot of advancement in the technology, sensing technology. So multi-channel sensors are available where you can record a lot of data at a time. And also, if you analyze these signals data independently, like each channel separately, then these data, they are correlated and they have mutual information that is ignored. So there is a lot of actually interest to develop multi-channel signal processing, multi-channel data processing, multivariate data processing, so that this correlation and mutual information is preserved in the channels. And also this due to computer science area, that empirical mode decomposition, adaptive signal processing techniques have come in the literature. So now if you apply individually, if you process these data channel wise, then each channel will have different number of components of that we call intrinsic mode function, IMFs. So that actually is a problematic for biomedical applications. So like one channel can have 5 components, other channel can have 10 components. So how to compare 5 with 10? So in order to have same number of components, that we call mode alignment property, that actually, so it is necessary to use multi data processing, multi-channel signal processing, multi-channel data processing for this entire data, for the joint, for all channels needs to be considered. So due all these reasons, this new area of research is coming in the actually in the data processing, that is multivariate signal processing, base time frequency representation, multivariate signal processing based decompositions, etc. And people are trying to combine them with the machine learning AI. So the first technique that actually that turned the signal processing in this direction, that was empirical mode decomposition. It from computer scientists, group of computer scientists, they developed this algorithm. Before that, we use all mathematical expressions to represent signal in terms of simple functions. So here what we do, we have data, and you don't need to design any basis functions from your side, like in Fourier transform, we have sinusoidal function that we design from our side. Wavelet transform, wavelet we design from our side. Here, you don't need to design any basis functions. On the other hand, actually you obtain the maximum minima from the signal, and based on maximum minima, we interpolate them separately, and then we generate the twin envelopes, and then we take average of these twin envelopes. Then we subtract that from the signal, and then is this signal or what this that is needs to be IM, intrinsic mode function. Intrinsic mode function means now whatever part of the signal we are getting, that is actually intrinsic part of the data. We are not representing forcefully, because we are obtaining this signal from the data itself. So that way it is intrinsic mode function, and it needs to satisfy 2 basic conditions of the IMM. First one, number of extreme and number of zero crossings should be defined at most by 1. So this condition ensure that whatever IMF you have, that looks like sinusoidal function. And second condition, ensure that this average value is 0, so it looks like a symmetric function. So in that way, whatever IMF you obtain, that is symmetric and sinusoidal function, so that narrow band signal. And once you obtain the first IMA, then for the second IMA, we subtract this first IM from the data signal, then you have residual, and then repeat the same. So in that way, we obtain all possible IMA. So like this is Professor Flandrin and his team has shown that this decomposition is also similar to wavelet transform. Our good thing is that here we don't need to know how many decomposition levels are required, and we don't need to know which wavelet is required. So without all doing all these things, adaptively, automatically, you are decomposing data in terms of IMFs, and which are similar to wavelet transform. So this first IMF, that is at the lowest scale or largest frequency present in the data, that we call details. And last one, eighth IMF in this example, that is the lowest frequency or largest scale of the data. So we call it approximation. So like in wavelet transform, we have approximation details of the data. Similar way we can obtain here. So based on this concept, many approaches for multivariate signal processing have been, or image processing have been proposed. That is complex EMD, rotation invariant complex EMD, bivariate EMD, multivariate EMD, fast MEMD, etc. And these empirical mode decomposition, it has two serious limitations when you use for real life applications. So one is actually doesn't have mathematical expressions, so people find difficult to interpret the results. And also second one is it is a mode mixing problem. So this one mode IMF, it has actually sometimes represent multiple frequency, multi-mode kind of pattern. So that non-mode mixing. So now we will see actually two applications here for this seizure epilepsy and schizophrenia. Human brain is a highly complicated nonlinear system, and electroencephalogram, which we call EEG, they measure the electrical activity generated by the neurons in the brain. And here actually what happens in the human brain, all neurons they synchronize together and they generate very high electrical activity. So due to that, actually there is a large amount of electricity in the brain, and brain becomes disturbed because human brain is the master of the body. Once brain is disturbed, then everything is disturbed. So it is a very serious disease, and epilepsy affects around 2% population of the world. And EEG signals, which are commonly used for the diagnosis of epilepsy. So we have proposed empirical wavelet transform based approach for patient-specific epilepsy seizure detection using surface EEG signals. So here you see there is a human brain. It has four major lobes: temporal lobe, frontal lobe, parietal lobe, and occipital lobe. Whatever you do directly, indirectly, everything affects the brain. So that actually here it was different regions. So now how to measure the signals, EEG signal from these regions? Then this 10 to 20 system is proposed in the literature. We put this on the brain and record the signal from different channels. So this is one example of two-channel EEG signal. And some groups, researchers, they have considered this as an image. So like instead of using this multi-channel EEG, they have taken their images and then processed them with the CNN deep learning. But here we actually, by applying signal processing, we will get more insight about this that we will see in this talk. And so this motivation for EWT, empirical wavelet transform, it already EMD suffers from mode mixing problem, and that's mathematical theory. So EWT actually has measured three steps. First, we obtain the Fourier spectrum in the frequency due pi, and then that is done by applying for fast Fourier transform. Then we segment Fourier spectrum into different segments using EW boundary detection method. And for each segment, we design the empirical wavelets, and then we use the bandpass filter to separate out the intrinsic mode functions of the signal. So our contributions include extension of EWT method for multivariate signals, and then we apply time frequency representation of multivariate signals using EWT with application to imply seizure detection. This is actually very interesting time frequency representation. That is actually now this is another form of the image. So like you have biomedical data one dimensional, and it can convert into time frequency representation. And time frequency representation can be used as time frequency image, and then you can give on this as input to CNN, convolutional neural network, or deep learning to actually have this better classification, interpretable classification, automatic classification of these medical signals. So this is actually opening new direction of research. In issue of biomedical signals, you can use time frequency image of these multi-channel signals, and then actually apply CNN or advanced machine learning algorithms. So if you see, this is the mathematical model for this multivariate data. Each channel like multi-channel signal, and each channel, if you apply EWT, then actually what happens, every channel will have different Fourier transform, different spectrum, different segmentation, different design filters. So as a result, each channel will have different number of components. So in order to avoid this, or in order to have mode alignment property, we have suggested take actually average of the Fourier spectrum of all channels, and then based on this spectrum, design the actually filters, segment the spectrum, design filters or bandpass filters in the form of wavelet, and then you apply for each channel same. So in that way, you will have same number of components from the each channel, and then you actually we have applied Hilbert transform to each channel, each IMF, that gives you amplitude, envelope, and incidence frequency. So then we have suggested this computer joint distance, amplitude, and joint distance frequency from all channels, and then for time frequency representation for particular frequency is expressed in this way, and then this mathematical expression for getting time frequency representation for multi-channel data. So this epilepsy, when you go to hospital, then actually generally neurologists they detect epilepsy based on the two features. First is like they have large amplitude and spikes in the data, so EEG data. So that motivated by that, we have also proposed the features which are actually based on the instantaneous amplitude, that is mean of joint instantaneous amplitude, mean of monotonic absolute AM change, and variance of monotonic AM change. And this is the mathematical actually, this is like model, this block diagram, whatever you have seen mathematically. Here, this is the block diagram for proposed epileptic seizure detection system. So here you have 23 channels. If you use all channels together, this is studied from CHB MIT Scalp E database. Then actually, this is the huge computational complexity. So what we suggested, we select 5 channels, and then actually for these you apply multivariate empirical wavelet transform. Then all 5 channels you have 10 modes, and then compute distance, amplitude, and frequency for each mode, and joint distance, amplitude, and frequency of each mode is computed, and then from that feature extraction from mode 1, mode 2, mode 10 are computed. And then these features actually somehow they are noisy, so then we suggested feature processing, and then processed features are given as input to machine learning classifier, and automatically it will classify whether it is seizure or seizure free. And there is a lot of you, like somebody driving a car and he or she is going to have epilepsy seizure, epileptic attack, then actually such methods will detect in initial stage. And once you detect it, then you can stop the car, you can generate the alarm, and then you can have epilepsy drugs, and then actually you can bypass this attack. So there is a lot of use of such kind of systems for epileptic patients. And here now you see this is actually 5-channel EEG data for epileptic seizure case, and this is for seizure free. And now you see time frequency representation. So this is one kind of image, time frequency image for this seizure, and this is for seizure free. So this actually is very nice signature for computer-aided medical diagnosis. Instead of looking the EEG signals, one can look this time frequency image. And based on this image processing or just visual image observation, that actually one can see that in case of seizure, it has all kind of frequency component, low frequency component as well as high frequency component. On the other hand, if you see seizure free, there is only low frequency component. So it is a actually very useful signature for the diagnosis of epilepsy, and rural areas people can do it. It is a simple actually feature and easily can be understood by the anyone. Now, if you see these features that actually we have proposed about 10 modes obtained from all channels, they are noisy, this first, second, third feature. So in order to reduce this noise level, we have suggested moving average filtering. And then these are the filtered features for each mode. And now you see it is improved the discrimination between seizure and seizure free parts. So further we multiplied all of them, that we call Hermann product. Then we get joint feature vector. So higher will be higher and lower will be lower. So this is very nice actually joint feature 1, 2, 3. You can see this. And this is a raw EEG signal, and from this you can see that it is difficult to detect seizure here, because it is noisy. But by using signal processing, one can actually detect the seizure precisely. And this here you can see seizure becomes severe in the middle. So this interval can be used to detect the initial stage of the seizure. So that is actually that we use for predicting the seizure. That is very initial part. That signal processing can tell you. Machine learning can do classification. Machine learning can tell you whether you have seizure or not, seizure or seizure free. But what time and what is the spread of that, is what is the frequency of seizure, how much severe it is, that actually signal processing is needed. So machine learning is good for classification, and signal processing can help you to analyze and to perform analysis and interpretation of these results when you take in the form of signals. So this actually new direction of research is coming when combining signal processing with machine learning, that we call interpretable AI and explainable artificial intelligence. So where classification is done, results are getting, but how to interpret them. Signal processing actually can help you to interpret these results, what we are getting with the machine learning based approaches. Then in the literature, many methods actually have been studied based on signal processing and machine learning for this study database, CSB MIT. And we have compared our method with other existing methods in the literature. And you can see it's a studied method gets actually 99.57% specificity, 97.99% sensitivity, and 99.41% accuracy. After that, this another actually this method, that is iterative filtering. So this empirical wavelet transform that was actually motivated by the EMD, and this is another transform, that is iterative filtering. So empirical wavelet transform, what we are doing actually is filtering. We are filtering out signals based on the wavelet filters, but they are based on the maximum, minimum, and the frequency domain. Here we are actually designing filter that is based on the maximum minima of the data itself, so like EMD method. So here this good thing is that actually this filter cutoff frequency is dependent on maximum minima of the signal. So like this is a formula for filter length and between filter length and number of extreme. So now you have a high frequency component, then actually this high frequency component K will be high, so filter length will be less. As a result, cutoff frequency which is proportional to 1 upon L. So cutoff frequency will be higher. So high frequency, cutoff frequency is higher, lower frequency K will be less, so L will be high, cutoff frequency high. So automatically low frequency and high frequency, this cutoff frequency actually is adaptively chosen by this method. So once you have this cutoff frequency, then actually we design the filter, and this filtered signal is subtracted from the signal. Then we have residual, and this residual we repeat a number of times. Then you have first IMF. Then you subtract first IMF from the signal, and then you have residual. And repeat this number of times. Then actually you will have second IMF. So in that way, all IMFs can be tried. And these methods actually trying for biomedical signals and images. And just for simplicity, simply for analysis, we have taken simple examples in the form of signals. So here in the frequency domain, how this iterative filtering works, we have three IMFs, and when you see this is a design filter, and the filtered signal will be this is the filtered signal, and then we subtract this filtered signal from the signal in the frequency domain, just for an example. Then you have this first IMF, and first IMF is subtracted from the signal, then you have residual. Now we are doing this for second IMF. Residual doesn't design filter, this is a filtered signal here, subtract from there, and then second IMF. So first IMF, second IMF, that actually we subtract this from the signal, then you have residual, and that itself will become third IMF. So like that. So here, now if you apply this iterative filtering for each channel, in case of multi-channel data, then each channel will have a different number of maximas, different filter length, different cutoff frequency. So as a result, each channel will have different number of IMFs. So it is problematic. There is no more alignment property. So what you have suggested, you take multi-channel data, and they then determine the extrema for each channel and take the maximum value of that, and that is according to that actually you design the filter length, and from the filter length design the filter, and that filtered signal is subtracted from the signal residual, and then you repeat this process many times, reasonable number of times, then your first IMF. Then you determine residual and you repeat the same process. So there are two stopping criteria. Standard deviation is equal to 0, then this signal is weak, we can stop it. And number of extremas is greater than 3, then actually we continue. So because this standard deviation greater than 0, then signal strength is there, we continue, and number of extrema greater than 3, there is frequency component, signal has oscillating nature, then actually we continue. If not satisfied, then we can stop them. So this is one example how this multivariate filtering works for bivariate data. So now you have two channel data and this frequency domain. So it has two IMF, first channel has two IMF, second channel has one IMF. So if you apply channel wise, individually channel wise processing, then first channel will have two component and second channel will have first component. So there is no mode alignment property. This is not same number of modes. So what we will do, we will find maximum of both. So this is the maximum that will be actually used here, and here that is filtered signal will be subtracted from the signal, that is first IMF. Now it is two channel IMF that will be subtracted from the signal, that is residual. Then we again design two filters with the maximum. This will be common for both, and then actually we subtract this from the this signal residual, then it is second IMF. So first IMF, second IMF, both are now subtracted from the signal, then you have residual, and that residual that itself will become, because the filters are 0 now both cases, so 0 maximum will be 0, so there is no filtering. So third IMF residual itself will become third IMF. Now what to do actually, what is the use of this multi-channel signal processing? So one of the real life actually application, like in ICU, we want to have more reliable vital parameters, and that is actually like we record signals, multimodal signals are there, multimodal data, and how to find out the common information. So this is ECG lead 1 and this is ECG lead 2, this is respiratory signal, breathing signal, and fourth one is seismocardiogram. Now these all four signals are recorded at different instrument, and if you apply multi-channel signal processing, then actually these are out of all these four records, it will bring common information together. So maybe like IMF 11 can be used to compute the heart rate based on this multi-channel, but this all these four components will be from the different modalities, so that whatever vital parameter you will estimate, that will be more reliable. So that is actually one of the nice application. And another application of this we have applied is schizophrenia detection from EEG. Schizophrenia is actually chronic and severe mental illness, and I think this is one of the serious mental disorder, serious neurological disease, because it changes the thought process, thinking process completely of subject of the patient of the schizophrenia. There is one movie, this Beautiful Mind, Professor John Ness, that actually he has schizophrenia. He's schizophrenia patient in that movie. And when he was a student at Princeton University, he was having one of his friend, that roommate, his name was Charles, and there was no Charles in that university. Actually, that this schizophrenia people, so patients, they actually imaginary things they consider real. Like there is no person, but for them it is a real person. No sounds, they are imaginary sounds, but for them they look like real sound. So this Charles was not there, but Charles was very good friend of Professor John Ness, and Charles also once introduced his niece to John Ness, and there was no niece, there was no Charles. And the same way, actually, when he was delivering a lecture in the university, so John Ness, and then actually a lot of people are attacking on him, and but nobody was attacking on him. So for him, actually developing such kind of system thinking process, and many people they wanted to catch him, and after class, actually many people attacked on him, that Russian agents had the William. And after some time, only one person was left with the Jonas, and then actually so Jonas was understanding, thinking that he is William, but that person says, I am neurologist and you are suffering from schizophrenia disease. So for that, actually for the person, for your Professor Jonas, everything looks like real, but in the real life it was not existing. And where the same Professor Jonas, actually after some time, he himself understood that that whatever he looks, that is actually he looks or he interprets, that is not actually real, that is imaginary. Because Charles' niece, from last many years, she was looking similar to him. There was no change in there, she was not aging, there was no change in the grace. So that actually then he convinced himself that actually this is he has disease. It's not actually real things, because they are not changing. Real life things change with time. And later, Professor John Nash actually got Nobel Prize. And when he was acknowledging his family for his help for this achievement, then these three imaginary persons, Charles' niece, and William, they also came there. They want to have acknowledgement. So this schizophrenia patient, that is always actually between real people and imaginary people. So sometimes his wife wanted to convince Professor Jones that these people are imaginary people. Neurologists want to convince that these people are imaginary people. But this imaginary people wanted to convince him, Professor Jones, that these are actually they are not telling, they are telling lie, they are not true. So in that way, this person is always actually struggling between real people and imaginary people, and is very serious disorder. And if it is detected in initial stage, timely treatment of that can be done. So it affects 20 million people worldwide. This is 1% of world population, and more than 1 million people in India. And its symptoms, they are hallucinations, disorganized speech, thinking, abnormal motor behavior. And this is the actually proposed block diagram of schizophrenia detection method. So we have M channel EEG, and then we perform segmentation, pre-processing, then multi-channel EEG, multivariate EEG signal, that iterative filtering that we have proposed, that is applied here. And from the each channel, we have n number of modes, so it's mode alignment present. Then this rhythms actually delta, theta, alpha, beta, gamma, that is actually rhythm was also very old time. It was defined by the Berger, and Berger also is very interesting story about this EEG. When Berger invented EEG signals, and Berger was part of German army, and he was fighting for a battle, uh, and then actually he fell down from the horse. He was horse rider. Then actually his sister, she was many kilometers away from that place. Sister actually felt that his brother has got a lot of injuries. And this then she conveyed this message to her parents. And the parent, that time there was no mobile or these communication devices. Then actually they send telegram to Berger, and Berger confirmed the same, that he has got a lot of injuries. So Berger surprised how his sister came to know that he has a lot of injuries he has got. So that actually he believed that his brain is transmitting signals, and sister's brain is receiving all of them. And based on this belief, after retirement from German army, this Berger actually started doing research on this understanding this communication, and then actually he come with the EEG signal, and he concluded that whatever he was thinking that was wrong, so that was just telepathy. So the brains don't communicate to each other. So that was very old actually definition of the EEG rhythms, and recently we have modified them, and we have come up with the multi-channel EEG rhythms. Then we have extracted features from the EEG rhythm, then perform classification between healthy and schizophrenia subjects. So for the study purpose, we have taken this public available database from Institute of Psychiatry and Neurology for Poland. And schizophrenia case, there are 14 patients, 7 males and 7 females. For healthy case, we have 14 subjects, 7 males and 7 females. And the signals are recorded from 19 channels and sampling 250 hertz, duration in 50 minutes. So here now you can see 3 channel, that's 3 channel EEG data. And now second, third, fourth IMFs you can see, and you can try them in the form of image. So this biomedical imaging kind of methods can be studied for the schizophrenia detection. So now if you this you can see second, third, fourth intrinsic mode function multivariate, they represent the same frequency component, which is clear from the power spectrum density. So mode alignment property there. Then actually we compute the mean frequency, and mean frequency for there is a different frequency range for the theta, alpha, beta, gamma rhythms, and based on mean frequency it is coming for the particular component is coming between zero point 0.1 hertz to 4 hertz between this. Then we take that component as a part of the summation. So in that way, delta, theta, alpha, beta, gamma, actually these terms are segregated, separated out from these obtained components. And you can see here delta, theta, alpha, beta, gamma in the form of this multi-channel data. So one can actually consider them as image also, and can apply CNN, deep learning. And by doing this, actually nicely you can interpret all the results also, because you have rhythms also, and then you have conventional whatever this CNN deep learning. So these features actually, Hazard actually mobility and complexity, they are studied in the brain computer interface widely. But due to many advantages, we have also studied here in schizophrenia detection. So if you see total features now, number of channels are 90, terms are 5, 0.3, so 285. So in order, parsimony principle say that actually you should not use more number of features or parameters or model orders than the required. So we apply student t-test based on the probability value. It is less than 0.05. So here I is significant one. 20 best 30 features are selected out of 285 features. So healthy and schizophrenia cases, you can see these features. They have discriminative feature. They represent different range, and they are discriminative in nature. So that actually, and with less probability, and that more is more clear from the box plots. And here healthy schizophrenia classes, they are actually showing discriminative nature, and that motivates us because they are not perfectly separated. So you motivate us to use machine learning based classifier, and then actually you can map then high dimensional space and can separate out. So for that we have used best 30 features to differentiate EEG signals corresponding to every schizophrenia. And following classifiers are studied: SBM with cubic kernel, SBM with quadrature, linear, and linear discriminant analysis, K-nearest neighborhood classifier, decision tree classifier. And based on a trial and error method, we have selected 30 features, which has given 98.9% classification accuracy. For performance analysis, accuracy, sensitivity, specificity, positive predictive value, area under ROC curve, receiver operating characteristic curve have been computed, and mathematical expressions for these parameters can be seen in the slide. And then we applied 5-fold, 10-fold cross validation, and with the different classifiers: accuracy, sensitivity, specificity, positive predictive value, area under ROC curve. And when you compare all of them, then is 10-fold cross validation, SVM with cubic kernel gives you better performance. That is actually, so that we have compared with other existing methods in the literature, which have been studied on same database. And then, so this is the actually conclusion of this entire talk. We have proposed multivariate empirical wavelet transform and multivariate detail filtering, which are able to decompose multi-channel, multivariate signal into meaningful components. And in this talk, we have shown for these biomedical signals, but they also can be extended for biomedical images. So this also can be studied for like fundus image, this MRI image, this X-ray images, CT or images, all these images, and you can represent them in form of simple sub images, and then you can extract features and perform the classification. And also whatever you can see this multi-channel data that we are using from signal processing, but some groups we have seen they are also converting them in the form of medical image, and then if they are using classifier. So it gives you many directions of the research, and they perform this advanced CNN or deep learning classifiers. Mode alignment is the most important properties of multivariate decomposition technique, and the proposed methods properly align the similar oscillatory component across different channels. So like in biomedical applications, suppose you have multi-channel signals, multi-channel images, and each channel, if you are processing, giving different number of these components, then interpretation is difficult because comparison is problematic. So these our methods, whatever you propose, they are mode aligned oscillatory components, and they can give more insight about the data, about the images or medical signals. The proposed methods have provided good detection performance for epilepsy and schizophrenia diagnosis based on the scale EEG. So this actually, this we have used the EEG signal here, but when real life, like this is generalized seizures, but when you have focal epilepsy, then 85% cases they are drug resistant epilepsy, because that particular region actually it is this generalized seizure, it can go to anywhere in the brain, and focal epilepsy, that is a specific region is made, and you have to identify that region. So EEG signals are very useful, signal processing, machine learning, and same time we need MRI also, because we want to know the how much spread is there in the area, how much that is spatial. So EEG signals gives you good time resolution. MRI gives you a good spatial resolution. So combination of both needs to be studied actually for proper diagnosis of the seizure. Suppose you have focal epilepsy, then actually the drug resistant epilepsy, you have to include MRI also with the EEG. For generalized seizure, EEG is fine. So the proposed automated techniques can be useful for assisting neurologists in their decision making. And this actually good thing is that they are in the form of software. They can nicely integrate it with the computers. So computer-aided medical diagnosis can be done. And the computers, smartphones with the proposed algorithms can be used for the diagnosis of these neuro disorders in rural areas where you have shortage of doctors. So this actually here uh, this smartphone, if you integrate this actually is easy recording system. So these days easy recording system is coming in the form of compact form like e-motive, and this is from the belt only. So just you that is wireless, and you put, and this easy signal will be recorded in your mobile smartphone, and that algorithm will run and automatically it will be analyzed, and this results alarm will be on. So that is actually in phone will do very good work, and smartphone will become really smart. So that is actually nice use of the smartphone, and disease can be detected in initial stage. So this actually this is in the future directions, like whatever we have done, that is actually just it is for computer aided medical diagnosis, and this wearable devices based on this kind of concept. So that actually for the field, if somebody is working in the field, that person also can use in the form of wearable device, and then actually he will always be wearing it. So anytime whenever seizure or schizophrenia is initiated, it can be detected in the initial stage, and so timely treatment can be carried out. That is actually our group is actually working on such kind of work. So this talk is based on the recent these two publications. So I request all the participants to go through these papers in order to have more information about the presented work. Thank you.
Yeah. Thank you so much, sir, for the for a wonderful talk, and also have shown us the importance of uh, EWT, basically empirical wavelet transform, and a variant which you have proposed. The participants have already seen yesterday the usage of wavelet transform and how to apply wavelet transform over the images and how to design a machine learning based system. So now Sir has also talked about a variant of the wavelet transform which is even better than that. So participants can also take the advantage of applying the EWT and the multivariate variant which are as proposed, and they can also have a comparison among traditional wavelet transform and the proposed EWT variant, so they can have a comparison and find the importance of it. Thank you very much, sir, for giving us the idea of EWT and its uses. And now I request the participants, if you are having any query, you can just write your query in the chat box. Sir, you can just check the chat box. If they are having any query, they can only write in the chat box. They cannot unmute their mic.
See, one of the major difference between this conventional wavelet transform and whatever I have presented today, that actually these biomedical signals and images, they are unknown. They don't forcefully we are representing them in terms of wavelets or sinusoidal functions. And here, whatever is presented there, actually whatever basis functions you are obtaining, IMFs, they are part of the signal or image itself. So it is adaptive kind of approach, data driven. So that is actually data independent. So whatever image is coming, whatever signal is coming, our basis functions are fixed. So one question is there. Can EWT based approach be used for ailments for which only imaging methods can be used for diagnosis rather than signals. Yes, so that actually the signals for the purpose of explaining whatever we do this one-dimensional signals, always these image processing methods, in most of the cases they develop for one-dimensional signal, then we extend this for two-dimensional case. So already two-dimensional empirical wavelet transform is there, and we have studied this for glaucoma diagnosis based on the fundus images. In the similar way, but now instead of one image, suppose you take multiple images, uh, then actually nice, then you can apply such kind of framework for imaging also. Like so generally you have one, but you can have multiple projections, multiple images. Then this multivariate image processing kind of methods can be applied. I think this nobody has tried. We have done for one-dimensional signals, but this concept is actually new. It can be tried for uh, multi-channel image processing also. When you have like initial fungal thumb impression, for example, you have multiple thumb impressions. So now you can come all of them. It's like a blind source separation, blind image separation. So like you have multiple measures, multiple measurements of image, and then you can treat all of them multivariate data, and then you can process them